Even with vaccines being rolled out, it has been 12 relentless months. Around the world, so many industries, sectors and lives have been affected by the pandemic. Education has been severely disrupted. The UN says the virus has affected nearly 1.6 billion students in more than 190 countries. You see over there, that is 94% of the world's student population. Now, when lockdowns were imposed, schools shut. Many shifted classes online and students had to switch to remote learning. Experts say this had a far-reaching impact. Children are spending more time at home, often in front of screens. Now, they can't interact with their peers and they may be missing out on the benefits of being in a stimulating environment. Now, it's thought the average American student could fall 7 months behind academically if classes in schools don't fully resume by next month. On the other hand, virtual classrooms may reduce problems like school bullying. But still, school routines are important coping mechanisms for the young. Being at home may worsen behavioral problems, and younger kids may have trouble adjusting when school resumes. And as lockdowns ease, many regions have reopened their classrooms, but it's not the same. Students have to adapt to a new normal. Teachers now have new roles to play, and they have to be an educator, nurse, IT support, and social worker all at once. The pandemic has also exposed the educational digital divide. Those in poorer and more rural regions don't have the same access to the internet or hardware to learn remotely. On the brighter side, there's now a renewed focus on how to reduce such inequalities. Well, let's get a closer look at how the pandemic has affected us emotionally. And for that, we're joined by Dr. Andy Ho from the Nanyang Technological University. Dr. Ho, many of us have had to spend a large chunk of time with our families because of such lockdowns. But it's not always good news, is it?
No, it's not. A lot of us, I think, has been really hard hit by the pandemic in terms of experiencing fatigue, anxiety, depression, and mental exhaustion, just being fed up with the whole situation. And I think there are a couple of groups of vulnerable people that are much more hard hit than others. For example, older adults who are living at home or living alone and requiring assistance for activities of daily living. They may even feel more isolated and lonely because of the inaccessibility to support. Now, this group of individuals are also not tech savvy or have the technology to access these virtual support systems, and therefore they may fall through the gaps. You mentioned earlier about students not being able to develop and continue the social relationship that they have. And that is very true. In the lockdown or in the circuit breaker period, a lot of those students at the university are required to send home. They may go home to a pressure cooker environment, or they are stuck in a university campus with no one really there. And so it really stunned the development in terms of identity formation. There are other people who are suffering from chronic diseases or disability. They're lacking support in terms of getting rehabilitation services. And one particular group of individuals, such as stroke patient, who needs to go back to the clinic to receive rehabilitation, cannot do that virtually. So they are really missing out in their recovery process. Family caregivers who are taking care of chronically ill patients are also experiencing a lot of stress and frustration because they don't get the respite that could potentially happen without the lockdown. And I think, more importantly, there's also this group of individuals who are living in a family whereby there's an abusive partner or abusive member, and being in that environment 24/7 without anywhere to go, it can really bring them a sense of hopelessness and helplessness. So there is much more that we can potentially do to support these vulnerable population groups.
Yeah, Dr. Ho, continuing with what you're saying there, the fact is that many people are now being almost forced to work and study from home just because of how long this is sort of prolonged for and the accommodations made by employment and by schools and things like that. Do you think this is something that's here to stay?
Well, I think at least for the foreseeable future, right now we are seeing good news, hopeful news that the vaccine may be available, but we all know that it takes time for everyone to be vaccinated in Singapore and around the world. And so there is a possibility for us to continue with work from home and being isolated or enclosed in a home environment. And we need to be able to find ways to be creative, to live in harmony with our family members, and also find ways to maintain emotionally connected with our loved ones and as well as the people that we care about. I think in the very beginning, when we have the COVID-19, there's this word of social distancing. I think we have changed that vocabulary to call it physical distancing, because being able to distance ourselves physically with other people does not mean that we're emotionally or socially distancing ourselves. So we need to find ways to connect with other people despite being physically apart. And we have been doing a really good job with that. We're using creative use of Zoom, party line, and different ways to connect with people regularly. But it's just that for a certain group of individuals who don't have the technology, who don't have the know-how, may not have accessibility to these platforms. I think for people who do have access to them, we also need to be able to find ways to connect with each other in a more concrete, structured way. Maybe potentially we can find topics to discuss every time we meet over Zoom, or find activities to do together despite physically apart.
Many thanks for sharing your thoughts with us this evening, Dr. Andy Ho from the Nanyang Technological University.